Good morning, everyone. It's so great to be with all of you here in person, and thanks to everyone joining us online virtually. My name is Kaz Rafi. I'm the first Chief Health Equity Officer for CareQuest Institute. It's a true privilege. CareQuest Institute is a leading national nonprofit focused on creating a more accessible, equitable, and integrated oral health system for all. We do that by collaborating with payers, providers, thought leaders, local, state, and federal stakeholders to be able to accelerate the transformation of this oral health system to make sure it is, in fact, equitable and actually makes sense. We know that oral health is inextricably connected to our overall health. That's been established. Yet oral health care and its access is non-existent and it's inconsistent where it is available. And that happens across all socioeconomic status, but particularly the impact is for those that are low income Medicaid recipients. And it's this lack of insurance, it's this lack of coverage that downstream is a driver for health disparities. This health disparity is particularly felt across the underserved and marginalized communities. And what we're aiming to do is to really strengthen this dental benefit. And that is going to be a critical piece in advancing oral health equity and equity overall. To advance this conversation, it is an absolute privilege to be joined this morning by Mary Beckley and Mehak Kaura. Mary is, of course, the CEO of Maryland Dental Action Coalition. Is this thing still on? It'd go off. Mehak is the Chief Policy and Advocacy Officer for Kentucky Youth Advocates and Kentucky Oral Health Coalition. Thank you for joining me. Oh, thank you. That's super loud. Thank you. Both Mary and Mehak have been instrumental in increasing access to dental coverage. In Maryland, Mary and her team have helped advocate for a bill that creates Medicaid adult dental benefits. And in Kentucky, Mehak works each year, and I want to talk about that, to prevent cuts to their existing Medicaid benefits for Kentuckians. We'll spend the next few minutes discussing these and learning about the work on the ground and what it takes to actually not just get to where you all got, but the everyday fight that needs to happen to make sure those cuts are prevented and how it translates into advancing our overall picture for health equity. What I want to do, Mary, is I want to start with you. Tell me what it took legislatively for you and your team to go out there and actually do the work that needs to get done to make sure this Medicaid adult dental benefit is passed for Marylanders.
Well, thank you. It's lovely to be here. It really took developing a relationship and a rapport and a stable of oral health champions in the Maryland legislature to educate their colleagues in Annapolis on the importance of oral health and the inequities and disparities that existed in accessing oral health care, particularly for Maryland adults who really hadn't had coverage in over 30 years. And this really led to the legislature instructing MDAC to do a study. They wanted to know about the financial implications. So a study on the financial implications of adults going to the emergency department for chronic dental conditions. And we fortunately were partnered with CareQuest Institute in doing this study. And it was really a groundbreaking study. It was a revelation in terms of showing the amount of money that Medicaid was devoting to paying for emergency department visits that were not treating the issue, just the symptom. Medicaid was paying for 53% of those visits, even though the Medicaid participants only account for about 15% of the population. So it was really quite revealing. And what I thought was really incredibly critical to this point is that CareQuest Institute not only did the aggregate for the legislators, but they also broke it down by county. So we were able to give those reports to our members, to our partners, to our stakeholders, for them to talk to their individual legislatures and show the impact of what was happening at the community level with their constituents. This led to the establishment of the Adult Dental Pilot Program, which provided care for thousands of Maryland adults, Medicaid adults, which really, again, was another layer of showing the importance of oral care to overall health care. And then, it was really kept moving forward. We worked to incrementally incorporate oral health into state health systems and worked to ensure the success of the pilot program, but at the same time, continued to work with our legislators and the governor, which, for instance, resulted in the expansion of postpartum coverage. The governor put money for postpartum coverage for 60 days, and then we worked with the governor and the legislators immediately the next session to expand it to 12 months. So we were expanding the adult population that was receiving care. And CareQuest Institute followed up the emergency department study in 2020, produced a similar report with similar results. It showed that Medicaid continued to pay for the vast majority of costs associated for emergency department use, even though Medicaid participants represented a small part of the adult population. This led to, at the MDAC summit, the legislators announcing their intention to file legislation, which passed.
Wonderful. That's amazing. I love the connection between the economic value and how it translated was validated. Mac, I'd love to hear from you about your work in Kentucky.
Yeah, certainly. So in Kentucky, a third of our population is actually on Medicaid. So we look at it from a budget perspective, that's close to half of our budget in Kentucky. And so the last I believe 3 years now, it's been where we've been really advocating to sustain that Medicaid budget and bottom line and protect that budget. And I say that because COVID has kind of illustrated the need for Medicaid and showed how people really need that care. And so that's what we've been doing. We've been mobilizing our advocates. We've been utilizing data similarly to what Mary has been doing in her state.
That's wonderful to hear. I mean, I'm so grateful for the work that not just are you doing, the wins that you're taking, but the continued fight to make sure that there's not a creep, if you will, in the coverage that exists. Now, while Maryland and Kentucky are really lucky to have you and your collaborators and your colleagues who are out there doing the work, this is, we know, not the case with all states. There are quite a few states out there, as the Congresswoman talked about, that either do not have Medicaid adult dental benefits, or those that do are inadequate, as we know. Earlier this month, I'm proud to say that CareQuest Institute launched a tool along with some of our colleagues out there to be able to sort of assess where dental benefit lies, where the overall dental benefit lies nationally. And we're really hoping this tool becomes something for policymakers, advocates, and administrators to identify opportunities to move forward with advancing the work that you all are doing on a national scale. This next question really speaks to health equity, if you will. I'd love to hear from you individually as far as the impact on someone who does not have access. What does it look and feel like? What are the individuals out there feeling that don't have this access? Mac, I'll have you start.
That's great. So I would just like to say that.
Yes, of course.
Thank you. I would just say the mouth is the gateway to your body. And so we know that it impacts the systems that we see every day. The Congresswoman has kind of illustrated the effects of oral health and its impact to health in general. But as a child advocate, I think something that's important that we need to share is that when parents have coverage, then children are more likely to have coverage, which means that they're also more likely to go to a doctor and a dentist and utilize that coverage. And so that's something that we're seeing as a child advocate.
Thank you for the question. Dental care transforms lives. It all ages. And if you have poor oral health, you're suffering. If you have poor oral health, you are dealing with chronic diseases that are getting worse without proper oral care. You're having a hard time getting employed, seeking employment. I see this every day with the Medicaid participants in Maryland. And, the best news really is when I do get these phone calls from adults looking for care, when I say January 1, coverage will start. You could just hear the relief in their voices. And, it's transforming lives. It changes a life from suffering into actually living.
Mm-hmm.
And what you just talked about is validated through CareQuest Institute State of Oral Health Equity Survey that was just released. And these are numbers that are not new to anyone who's in the business, who's in the know, who's aware of what downrange feels like for the individuals who don't have the coverage. We know that 60% of Black population reports tooth loss associated with periodontal disease or caries, and this is compared to 45% of population outside of the Black individuals surveyed, and higher population of Black and Hispanic population self-report oral health that is fair to poor. Those are certainly opportunities for work that needs to be done, and difficulty access to care has also been reported in this particular population. What I'd love to know about a little more, though, is how, when you did the work in the legislature, if cost was in fact a part of the argument that was made. I know you hinted at it. I'd love for you to expand on the cost impact, because it's really, really critical in making a cogent and salient argument.
Absolutely. Cost is always an issue. Whenever you start an issue, start a bill, start a legislation, everybody says, what's the fiscal note? And frankly, we looked at cost not being a cost. It was an investment. It was an investment in the health outcomes of the Maryland adult population, and it was an investment in the fiscal health of the Medicaid. CareQuest Institute, DentaQuest Institute documented that Medicaid was providing funds for coverage that was not addressing the issue, not addressing. And then you also have the correlation between good oral health and chronic disease management. Subsequent studies showed that Medicaid participants, in particular New York State, who suffered 2 to 3 different chronic diseases, when they had dental coverage, the costs associated with management of those chronic diseases, such as cardiovascular care, decreased. So it's not a cost, it's an investment. It's an investment in the population, it's an investment in the systems, and it's an investment in health outcomes.
Thank you. Mehek, briefly, if you can identify if you think there's opportunities for the federal government to sort of have more push in this area.
Certainly, I think there is. If you've just noticed with the American Rescue Plan, one thing that was provided with the American Rescue Plan is the option for states to utilize and extend their postpartum coverage for women. And that is really exciting news. And I know once that opportunity was there for states, we've seen states such as Kentucky going ahead and implementing that. And so if more states were given that opportunity, I'm sure we would expand oral health coverage.
Thank you both. I know we're running out of time. I just want to be respectful of other folks being here. I just want to, first of all, thank you both for being here. I think the community and advocates' perspective is really important if we're going to work towards an integrated oral health, expanding access and improving outcomes. Thank you all. I appreciate the opportunity.
Thank you.